This virus causes extensive damage throughout the system, more than any other virus that we've seen. A large, substantial percentage of patients are going to develop acute kidney injury or damage to the kidneys. And depending on the geographic region you're looking at, probably about 20% to 30%. If you're in the critical care setting, and these patients who are very ill with COVID, then you're looking at more up to 50%. Of those 50%, about 30 to 50% are going to require dialysis, and that's the statistics we have so far across the United States. There's several reasons why the kidney can be hurt or damaged. One is inflammation. When the body's very inflamed with any sort of systemic infection, it causes damage to the kidneys. Two, many patients may become dehydrated from high fevers. And when you're already dehydrated, that of course, if it's prolonged enough, can cause damage to the kidneys. We've also seen some patients develop what's called rhabdomyolysis, which is breakdown of the muscles. And the toxins from that can also deposit in the kidneys. So there's multiple mechanisms, but whether the virus itself has a direct mechanism, we still need more information on that. Many centers base their supply of dialysis machines, solutions, tubing, etc., on their usual population that they see. And what we're finding across the country is that the demands of these patients for dialysis is meeting the capacity of most of these institutions. And so there's already been multiple reports, especially in New York, of not having dialysis machines, not having dialysis solutions, tubing, filters. And then you have to think about the training too. Dialysis requires a special nurse to be able to do that. And if a nurse becomes sick with COVID, there's no one who can provide that therapy. So this is a big fear across the country. And even us, we've been told sometimes that our solutions we need for these kind of patients is not available. And so we're having to do a lot of alternative treatments to try to provide these needs for these patients. Luckily in Birmingham, we're okay right now, but that could change any day. So most of the time, if you have good kidneys to begin with, you recover. And we're seeing that. We see patients who come out of the ICU, come off dialysis and go home. It can take up to even 3 months before we will know if kidneys can recover. Those who already have underlying kidney disease, it makes it less likely to recover, but only time will tell.